Thank you for choosing Simplified as your trusted partner when creating dental prosthetics. This presentation will guide you through the step-by-step process of setting up a case using your Shining3D scanner, and provide key insights to help you achieve seamless, accurate results every time. To enter a new order, select the New Order button located at the top left of your screen. If taking scans on an existing patient within the software, enter the patient's name in the Patient Name section and select the corresponding patient. If adding a new patient into the software, select the Add Patient button. After selecting Add Patient, a pop-up will appear. Enter all required patient information. This is anything that has an asterisk next to it. Once all the information is entered, click the Confirm button located at the bottom of the pop-up window. Towards the bottom of the screen, you'll see the coded scan body serial number. The serial number indicates the scan body kit that you will be utilizing. Make sure the serial number indicated on your screen matches the serial number on the scan bodies. To change the kit, click the button located directly next to the serial number within the software. This will prompt another pop-up window with a drop-down menu to select the correct serial number that corresponds to whichever scan body kit you are using. After ensuring you've selected the correct serial number, you will then select upper arch, lower arch, or both. Next, you'll select the abutment locations. This step must be accurate. If the locations are incorrect, the software will flag the issue during scanning and prevent you from proceeding. Additionally, correcting the abutment locations mid-scan will delete all scans taken up to that point. Be sure to indicate the correct number of implants before moving forward. Once you've finished selecting the abutment locations, be sure to select the corresponding arches under the Scanner Pre-Op Model section on the right-hand side of the screen. After saving the information, proceed by clicking the Scan button. This will prompt you to select the implant system. Click Yes to continue. A new pop-up window will appear displaying the implant systems the office frequently uses, or has used in the past. When scanning for full arch cases, always choose the 4mm gold from Implant Direct. This is a desk scan body that is universal, and the majority of labs will request. Select the All Applications button and then hit the Confirm button. You will now begin scanning. Always start by scanning the temporary teeth. When doing so, ensure you capture enough of the surrounding gingiva, so that the scans of the teeth and gingiva can properly mesh. For the maxillary arch, be sure to capture the palate, and for the mandibular arch, try to capture the ridge behind the posterior teeth. This tends to provide better results when the software meshes the lower scans. Also, do your best to clearly capture the junction between the prosthesis and the gingiva. Pro tip: capture the bite before proceeding with the gingiva and scan body scans. The software will prompt you to take both the left and right bite. As long as you receive green check marks next to each scan, you are ready to move forward with the tissue scans. Once you've verified the abutments are talked to the manufacturer's recommendation, and completed the jig verification, you can proceed with the gingiva scans. The use of an Optra gate is recommended to help obtain clear and consistent scans. Be sure to capture the palate on the maxilla, as well as the buccal and/or facial angles on both the maxilla and mandible for optimal accuracy. If there is adequate data, the initial scan with the temporary teeth in place and the gingiva scan will automatically mesh. If the scans do not mesh, it typically means that there wasn't enough information captured, either in the teeth scan or the gingiva scan. When the scans mesh correctly, you'll see 2 green check marks at the bottom of the screen, and the result will look like the example shown on the left. You'll now place the scan flags. The screws within the flags are Strawman and should be torqued to 10 NCM. Ensure that the flags do not overlap or interfere with each other's ability to seat fully. Recommendation: use an Explorer to trace around the margin of each flag and abutment to confirm they've been fully seated. When selecting flags, use the longer scan flags in the posterior and the shorter ones in the anterior for optimal visibility and accuracy. After the software recognizes all scan flags, it will prompt you to scan the junction where each flag meets the abutment, on both the right and left sides. When the scans mesh correctly, you'll receive 4 green check marks at the bottom of the screen. When moving on to the second arch, or when finishing your scans, the software will again prompt you to select the implant system. Always choose the 4mm gold from Implant Direct. At this point, your scans should be complete and ready to send or export. At Simplified, our mission is to transform complex dental processes into streamlined workflows, delivering exquisite prosthetics crafted from the highest quality materials. We are committed to setting realistic expectations and consistently exceeding them in thoughtful, innovative ways, ensuring both clinicians and patients experience exceptional results at every step. Thank you for choosing Simplified.